Are you tired of being held back by discomfort and limited mobility? Well, you're in the right place. In this video, we're going to unveil a set of incredible techniques that can provide instant relief for your lower back pain. Yes, you heard it correctly, instant relief. Now, let's get started. Here are 7 ways on how to fix lower back pain instantly. Number 1, identify the problem. Correctly identifying the source of lower back pain, as the pain may not originate from the lower back muscles, but rather from the glute medius muscle. By understanding the specific muscle involved, you can target it more effectively and address the underlying issue. Number 2, identify the gluteus medius muscle location. The gluteus medius muscle is located just under the gluteus maximus and identifies a bony area called the PSIS, posterior superior iliac spine, that can be used as a reference point for finding the muscle. Number 3, understand the gluteus medius muscle. The gluteus medius muscle is responsible for hip abduction and maintaining pelvic stability during walking. Weakness or imbalances in this muscle can contribute to back pain. The glute medius muscle serves 2 key functions. First, it allows hip abduction, meaning it helps lift the hip up and out to the side. Second, it helps maintain pelvic stability during walking, preventing the body from leaning excessively to one side. Understanding the role of this muscle is crucial for addressing the imbalances that contribute to lower back pain. Number 4, self-treatment technique. By applying pressure with the thumb on the identified spot, one leg is extended in a specific direction to target the muscle. The movement involves going down until the knee touches the ground, then extending the leg backward and lifting it up while maintaining pressure on the muscle spot. This technique does not require using external tools like lacrosse balls, but rather controlling the pressure to avoid further inflammation. Number 5, testing weight distribution. By standing with feet shoulder-width apart and lifting one leg at a time, you can observe if you have to shift your weight significantly or if your shoulders tilt to one side. Unequal weight distribution can lead to imbalances and contribute to lower back pain, especially during exercises like squats. Number 6, strengthening exercises. You need 2 exercises to strengthen the gluteus medius muscle. The first exercise involves standing next to a wall, lifting the leg on the inside while preventing the hip from dropping. The second exercise, called the sack swinger, requires a dog leash and a weight, such as a kettlebell, attached around the waist. The individual walks while maintaining control over the weight, challenging the hip muscles. Number 7, treatment exercise as prevention. The self-treatment exercise demonstrated earlier is also recommended as a long-term preventive exercise to keep the back pain at bay. It can be used not only as a remedy for immediate relief, but also as a long-term preventive measure. Regularly performing the exercise helps maintain muscle strength, flexibility, and stability, reducing the likelihood of recurring lower back pain. In conclusion, addressing lower back pain requires a comprehensive approach that combines immediate relief techniques with long-term preventive measures. While instant relief is not always possible, there are strategies that can provide immediate relief and improve the condition over time. By correctly identifying the problem area, such as the glute medius muscle, you can target the root cause of your lower back pain more effectively. Understanding the function of the muscles involved and assessing weight distribution and imbalances further contribute to addressing the issue. The self-treatment technique demonstrated in this video, along with strengthening exercises, can provide instant relief and promote long-term healing and prevention. It is important to remember that fixing lower back pain instantly is not always feasible, but by implementing these strategies consistently, you can gradually reduce pain, improve function, and enhance your overall well-being. Seeking professional guidance, such as consulting with a healthcare provider or physical therapist, is always recommended for personalized advice and a thorough assessment of the condition. If you found this video helpful, make sure to like this video right now, subscribe to this channel, and hit that bell button for more tips on lower back pain. Thanks for watching, and see you in the next video.